Now, as I've been saying to you, of course, we're going to have an oral health interview today. And last year, the FDI, which is the World Dental Federation, launched their 3-year campaign, which is themed Be Proud of Your Mouth. Now, Be Proud of Your Mouth is not just about having a perfect mouth, it is also about having a healthy one. And the World Dental Federation would like people to value and take care of their oral health and to make the correct decisions in order to protect oral cavity. Now, this good oral status will require a lot of action. So be proud of your mouth by doing this, for example. Be proud of your mouth by visiting the dentist regularly. Be proud of your mouth by brushing your teeth twice daily. Be proud of your mouth by cutting down on sugary treats. And to inspire action, we need to explain why. And this is where the campaign strapline fits in. In 2021, the World Dental Federation encouraged the public to take action by focusing on the importance of oral health in order to enhance overall health. Yes. So now in 2022, they're reiterating this message by highlighting the fact that an unhealthy mouth can severely impact every aspect of life. And that is why we're calling on everyone to look after their oral health for their happiness and well-being. So today's oral health interview is proudly brought to you by the South African Dental Association, known as SADA, in association with the Oral Hygienist Association of South Africa, OHASA. And joining us today then to talk about all of this is Shaya Pillay, who's an oral hygienist. She's been doing a thing for 32 years, graduated from the University of Durban with Westville with a degree in oral health, and she's been in Medicross in Port Elizabeth for 26 years, which is where it's mostly general and family dentistry and primary prevention. Initially, it was mostly young families. However, now we're seeing many older individuals as well that is seeking Shaya Pillay's treatment. So we're going to be talking to her about the body-mouth connection, why and how the health of your mouth affect other parts of your bodies and vice versa, and what are simple habits like brushing and flossing, why are those so all important. So firstly, Shaya, thank you so much for joining us. Thank you for making time. Welcome to Clicks Live. How are you doing?
I'm well, thank you. Thank you for having us and giving us a voice. It's so important.
Listen,
so thank you.
Yeah, it is absolutely brilliant and absolutely fantastic for us to do so, because if I now immediately think of what the World Dental Federation is saying, that there is a link between immediate oral health and general health. I mean, this is a big thing, and that is why it is so important to have your voice and actually ask you all these important questions, because I want to talk about this body-mouth connection. Is there any? Is there even any?
Absolutely. I mean, your mouth is the gateway to your body. And the mouth is such a vascular area, and by vascular I mean it's got a rich blood supply. So if there's any kind of infection, inflammation in the mouth, it is going to have an impact on the rest of your body. And that is where the body-mouth connection, comes in. People don't seem to understand that. But it is so important. And it's becoming more apparent now where people are starting to understand that.
Yeah, and it's true when you say it like that. It is the gateway, it's the entry point. So whatever you put in, this is where it all goes in. So, now, but what can go wrong in the first place? What is there stuff we got to look out for?
Absolutely. So simple things like brushing and flossing and having a scaling and polishing regularly is where you would start. And so the first thing is inflammation, because what happens is the bacteria builds up, on your teeth, on your gums, along your gum line, which then cause inflammation, and the gums are then prone to infection. So the immune system then comes in to attack the infection, and the gums become inflamed. And this inflammation continues unless the infection is brought under control. The inflammation there and the chemicals it releases eats away at the gums and the bone structure, and then you have severe gum disease, which is also known as periodontitis.
That is a word I've heard. That is definitely our word. So so the first thing is you've got to look out for inflammation. Would that be your first trigger or your first sign?
Absolutely. You'd see the gum get a bit red, and when people do normal things like brushing, there'd be some bleeding. And then what happens then is when someone sees bleeding, then they're like, oh, I mustn't brush, because it's bleeding. But, you won't, unless you had a major trauma to your mouth. A bit of brushing and bleeding you're not going to bleed out. There'll be some bleeding, but it's okay. A little bit of bleeding is okay, but it's okay in that you're not going to bleed out. But a little bit of bleeding is what's telling you, hello, I need some attention. There's something going on here,
And Shaya, just to ask you this is not something that is prone for just the elderly or middle-aged people. I mean, you could be any age and this could happen.
Yes, any age. I mean, we see children from the age of like 3 or 4, because you know what children are like. They don't brush properly. They won't let the parents brush. And then you'll see. And then, that also leads to dental caries, which are your cavities and your holes. But it's the inflammation because, you can have the most amazing, beautiful teeth. But if your gums and the bone are not healthy, then what's the point? Because it's like having to put this bluntly, like having a really grand house on no foundation.
Oh, goodness. Yeah.
Yeah.
Yeah. Well, that is now definitely waking up the sleeping dogs. I got to be honest with you. Yeah.
Absolutely, yeah.
All right. So you got to look out for that. And now let's talk about this. And I just want to steer it in this way. So we know then there's a link and a well-established link between sort of general health, overall health, if you want to call it that, as well as to oral health. So it is almost like in a little way the mouth can almost be like a little bit of a window into what else could not be so hunky-dory within the rest of the body, if I can put it that way.
Absolutely.
Now, I want to ask you about diabetes, because is there a link between, let's say, oral health and diabetes? Because diabetes is one of those nasty little things, aren't they?
Yes, it is quite nasty. And yes, that is one of my like little, I love talking about this because it is so important. And, people with diabetes, it's one of the strongest connections, the body-mouth connection is with diabetes. Because,
is it?
Yes, because when you have inflammation that starts in the mouth, it weakens the body's ability to control blood sugar. Okay. So people with diabetes, then, they have trouble processing sugar because of a lack of insulin, which is the hormone that converts sugar into energy. So periodontal disease then further complicates the diabetes because the inflammation impairs the body's ability to utilize insulin. So, it's a back and forth. So if you can control the one, you can control the other.
I'm with you.
Obviously, it's not as simple as that, but like people look after their fingers and their toes when they have diabetes because it takes long to heal should you injure it. The same thing is going to happen in the mouth.
Are you serious?
Yes.
I've never heard that.
Yeah, you need to take really good care.
Now, and I mean that is a serious wake up call because yes, like I've heard of people when they talk about fingers and toes and and the digits and all of that, but but I've never given the same consideration, let's say, to in terms of oral health. So what we can establish that there is a proper working relationship between then the concept of diabetes and general oral health.
Absolutely.
Yeah.
Absolutely. I have young patients who have type 1 diabetes, and they've been coming in since they were little. And I mean, they are fine because you've reiterated it and taught them from a young age, and they are fine. It's the older people who don't know this, and they get diagnosed later on in life with type 2, and they're completely unaware of it.
Yeah. And so, in essence, what you are saying, if you have diabetes, you got to be extra vigilant when it comes to looking after your general oral health. So you really got to enforce brushing, flossing, and all of those.
Yes, you have to. Yeah. You have to. Your flossing may seem like, what an irritating thing to do. But you must remember the brush only brushes what you can see.
Yeah.
It doesn't go in between, and there's so much of plaque that sits there and attacks and causes the inflammation and then the infection, and it just sits there and it doesn't go away because you're not physically removing it.
Yeah. Now, since we're talking about diabetes, I want to just open up a whole bunch of topics then for you. Oral health and heart disease. There can't be a link. surely.
There is a link.
Oh, my goodness.
Your mouth's on your body and your heart in your body. So yes, there's definitely a link, yeah, for sure. And it often goes hand in hand. And up to 91% of patients with heart disease have periodontitis compared to 66% of people with no heart disease. So it's very, very interrelated. And, people really have to take care because I've read articles where they found mouth plaque in heart plaque.
Oh, is it? Wow.
Yes, and heart plaque is what clogs the arteries.
Oh, clogs the arteries, yes.
Yes, and causes inflammation.
Yeah.
So inflammation is your key word here.
Yeah, it really is. And it stresses to what you said earlier. Like, this is really the gateway to the body, what you put in your mouth. It really just stresses that. Now, but let's continue in this vein. Let's oral health and people who are expecting pregnancies.
Also very important. A lot of times mothers fall pregnant, but the gums are not healthy. And I don't know if you've ever heard this word, pyorrhea.
No.
So it's a word that was used in the old days, and it actually meant gum disease because gums would bleed, and they called it pyorrhea. And so mothers would fall pregnant, and their gums would be bleeding, and all of that. And then often, they'd have preterm babies, low birth weight babies, and it was because of that.
Pyorrhea.
Pyorrhea, but it's actually gum disease. They used to call it pyorrhea in the old days. We know now that it's gum disease.
Okay.
I learned that as well. I didn't know that until a patient came and told me that one day. And I went and looked it up.
Excuse the pun, but pariah is a real pariah then as far as oral health is concerned.
Good one. I like that. I like that, yeah. So having a healthy mouth is very, very important. Pre-pregnancy, so if you're planning a baby, make sure that everything's been taken care of. Go see your oral hygienist. Go see your dentist. Make sure that your gums are healthy. Because also when you're pregnant, whatever hormones work, on your body in order to allow the body to allow the growth of the baby, can also do the same thing in your mouth. So you can end up with a pregnancy gingivitis. And and if you don't treat that, then that can also get quite unpleasant. For you, and you don't want to put the baby at risk.
Yeah, no, you certainly do.
So your hormones also have a lot to do with it.
Yeah, and I want to get back to some of these conditions, and I'm going to throw more at you as well. But if you've just joined us in store, on the line with us that we're talking to, and I tell you what, as far as interesting conversations go, this is definitely one. Of course, it is World Oral Health Day, which is on the 20th of March, and we are joined this afternoon by Ms. Shaya Pillay, who is an oral hygienist, and we're talking about the relationship between sort of the body and mouth connection and everything to do with oral health around this as well. Now, so we know there's a definite link between heart disease, as you've said, of course. If you are pregnant, if you're planning, if you're expecting, then you definitely got to take care, as well as with diabetes. But now, I just want to touch base on some, let's call it bad habits, for lack of a better term here. Oral health and smoking, because I know this, because also earlier in the week I spoke to an oral hygienist and kind of confirmed the suspicion that people who smoke, like they will lose a tooth maybe once every few years or so because of smoking. But it is so much more than that, because this is really, you shouldn't do it.
You shouldn't smoke. I mean, we all know you shouldn't smoke, not only for your mouth, but for the rest of your body, and most importantly, your lungs. However, smoking, it just increases everything. So if you have a little bit of gum disease, smoking is going to make the gum disease. It exacerbates any condition.
Yeah.
The nicotine causes blood vessels to constrict.
Yeah.
Which you would then have, less blood flowing to an area, which means healing is restricted. So, it all just ties in. It goes hand in hand. So that means your gums can't fight off infection.
Yeah.
And interferes with treatment. and it delays your healing. So, smoking people should not smoke. They should just not smoke. But unfortunately, the whole world smokes, except me.
So what we have from it, and I hear what you're saying in terms of the nicotine and the chemicals and whatever the makeup is there, that kind of adds as the fuel to the problem. And of course, this is the entry point. Now, Shaya, if we look at something completely that might sound a bit far, is there a connection between oral health and osteoporosis?
So yes, you see, osteoporosis is where your bone gets weaker, and your oral health in the bone in your mouth with periodontal disease also gets weaker.
Yeah.
So there's a little bit of a controversy surrounding that, but if you think about it, bone gets weaker. Osteoporosis, periodontitis, periodontal disease. So mostly a woman suffer from osteoporosis, and mostly men suffer from periodontitis. If you take stats into account. However, the two are interrelated. So if a woman is prone to osteoporosis, then obviously if her gums and her bone in her mouth are not healthy, it's just going to exacerbate that as well.
Yeah, yeah. And with a link between that, I mean, I would imagine this is something that will be a little bit more prevalent, let's say, in more mature people, because bone becomes weaker the older you get.
Yes.
Yeah.
Yes.
Which actually going to lead me to the next thing I wanted to ask you. And I mean, I could be completely off the boat here, but rheumatoid arthritis. I mean, would there be a link between that as well? Because, as far as I know, that is like, the swelling you get at the joints, if I know that, which is not gout. I just want to be clear. Gout is probably caused by yourself because of high levels of acid, but the rheumatoid arthritis is just the swelling at the joints, isn't it?
No, well, it's an autoimmune disease, and it's also inflammation.
Okay.
And remember that word inflammation started out with diabetes and inflammation in the body. So obviously your inflammatory factors are higher, so it also just makes those conditions worse. So if you can keep the inflammation in your body under control, you would then also help to reduce the pain and inflammation if you have rheumatoid arthritis.
Yeah, so sure, it really encompasses quite a broad spectrum in terms of what health would be.
It does.
Yeah.
And also, with regards to like surgery, prosthetic surgery, and people are completely unaware that when they go for prosthetic surgery, that their whole body needs to be healthy. So that means your mouth as well. And now I find that many surgeons are actually sending their patients to come and see us to make sure that everything is good before they go into theater to have either a hip replacement or a knee replacement. Because if there's any kind of inflammation in the mouth, that prosthesis is not going to take. It's not going to heal properly. So very important as well. So, the word inflammation it's what makes us all old.
Yeah. Well, I say but okay. But I get the sense of what you're saying. So even you going now for a hip knee replacement or that sort of thing, you go for that. And if there's inflammation, and just to be clear, when we speak inflammation, we're not talking about a major swelling. Because this would be something that is in your mouth. Yes, there will be a significant swelling, when you have like a abscess or something. But this could be any little thing that will be like just a little bleeding or something. It indicates to something is not lekker or something is not hunky-dory somewhere else.
Yes.
This is what we're talking about.
This is what we're talking about. We're talking about exactly that.
Yeah.
Where there's a bit of calculus or tartar or plaque, and it's causing some bleeding, and it's definitely a little bit puffy, and it looks red. It's not huge. You can live with it.
Yeah.
But it's there, and it's definitely having an impact on the rest of your body.
Yeah,
for sure.
No, it certainly is. I wanted to touch base with you just and I want to do it in sort of a two-part quickly. Lung conditions when it comes to oral health and other conditions as well. And let's add obesity to that as well, because I think that is always a big talking point as well. Is there a relationship there?
Yes. So with lung conditions, periodontal disease can make, pneumonia and chronic obstructive pulmonary disease worse by increasing the amount of bacteria. So your bacterial load is in your mouth is high. Okay. And of course, you have an infection in your lungs. So that's just going to increase the bacterial load, which is going to just also exacerbate that condition.
Yeah.
You see?
Yeah.
And then when it comes to obesity, there are studies that have linked gum disease to obesity. And periodontitis seems to progress more when you are obese or faster.
Okay.
Yeah, when you're obese. Yeah.
Yeah.
So, what's very clear is that your body and your mouth are not separate.
No, certainly is not.
They are not separate at all. Like you go and take care of your fingers and your toes and your fingernails and your hair and all of that. Your mouth is so important.
Definitely sounds it. Shaya Pillay, that is where we got to leave it for today. Any sort of parting words? What is there that we can tell people? Because clearly, and thank you for putting things so succinctly. Like really, the mouth is the gateway to, I suppose, general health, if I can put it that way. Is there any sort of parting thoughts from your side?
So what I can say is go to your oral hygienist and your dentist at least once a year. Twice a year is ideal. Keep it under control. Don't let your gums get to the point where they're bleeding.
Yeah.
Because once they're bleeding, that's already inflammation, infection. And once that gum has receded, it doesn't ever come back. It's gone.
Yeah.
So if you don't manage it from the beginning, you can't reverse it completely. You can then just manage what's left. So your regular scaling and polishings with your oral hygienist and a checkup with your dentist is the best you can do for yourself. It's the best gift you can give yourself. It's the best gift you can give your children.
Yeah.
And if you keep that under control, then, we're not saying you're never going to be sick, but we are saying that you are going to lessen the chance of being even sicker.
Yeah. You definitely got to look at it. You
have to.
If anybody is listening...
In a holistic
manner. Absolutely. If anybody is listening to this and they would like to get a hold of you, how can they go about that?
So I'm at the Westring Medicross in Port Elizabeth.
Mm-hmm.
They can go on to online bookings at medicross.co.za. And or they can email me at shayapillay@gmail.com, and I can help them from there. But yes, I'm so excited to have been able to talk about this because it's so close to my heart.
You know what? And we can see it is closer to your heart. Your passion definitely weighs in a ton on this. But thank you so much for your time. It has been an absolute joy and pleasure having a chat with you.
Will.
Thank you very much.
Excellent host. Thank you very much.
Thank you,
Bye-bye.
Shaya.